Let's record. Okay. Good morning, everybody, and welcome.
Hi.
Yeah. Hi, Jenny. Day one of the Gatsum Challenge. We are really excited to welcome everybody to the Spring Challenge on our side. My name is Steve Murray. I'm co-founder of Health Architects South Africa. I'm an exercise physiologist and a health coach, and I'm delighted to have with me today my partner and physiotherapist and functional medicine practitioner, Jenny Haig. How are you doing?
Hi, Steve. Yeah, no, good. Thank you.
Stressful morning.
Nice to be here. Nice to kickstart this.
Absolutely. I must just tell you before we jump into this, having been involved in chronic disease risk reduction programs now for at least 10 years, really getting to understand, thanks to you from a functional medicine perspective, the importance of gut health has been a sort of real aha moment for me, because that's something, we never really considered before. So, but it really does tie those dots together, connect those dots together, which is very, very cool. So I'm excited to share information with everybody. First up is the question from me, genuinely, at the beginning was, so why is gut health important in the first place? Number one. And number two, why is it day one? Why are we starting in the mouth?
Well, I mean, what's often completely neglected and not even taken note of is that our gut starts in our mouths. Our mouth is the entrance to the gut. Everything that goes into our gut obviously goes through our mouth first. So that is really the starting point for our gut. So if we're not taking care of our oral health and what is going on in our mouth, we're not going to have a healthy gut. It's just not going to work. So the mouth is really the first point that we need to look at. I mean, we've got something like 700 different species of microbes that live in our mouths, okay? And they're pretty powerful microbes, some of them, and they can be pretty bad as well. We're swallowing between 1 and 2 liters of saliva every single day. So obviously that's going from our mouths down into our stomach and our gut. So if the microbes in our mouths are not healthy and good and the right kind, then we're going to be putting all of those bad microbes into our gut. So super important that we look at that. And then obviously from our gut, they can translocate into our blood vessels. And from there, they can impact your cardiovascular system, your immune system, your neural system, your immune system, your organs, all of that. So yeah, really important. It plays a big role. I mean, it's quite well known that a lot of cardiologists won't operate on the heart if a person has periodontal disease. So definitely significant.
Absolutely, absolutely, Klachi. And I suppose now we need to narrow it a little bit. Our particular niche and the people that we're communicating with today in our group. These are people that are dealing with metabolic conditions, or at least the risk factors for metabolic conditions. And we know, that certainly my understanding of metabolic conditions was kind of limited to metabolic syndrome, diabetes, etc. And now we know, we're talking about, fibromyalgia, CFS, fibromyalgia, and then even those neurodegenerative conditions which are so disruptive. So from a metabolic perspective, why, what's the connection there between the gut and those metabolic conditions, or at least looking to prevent, treat, and arrest them?
Well, high blood sugar levels will make you more disease prone. Okay, it'll make you more prone to infections, especially in the mouth. But the other side of that coin is that infections in the mouth can also raise your blood sugar levels. So it's a kind of a double-edged sword. When you get an infection, your body releases hormones that will increase blood sugar to fight off that infection. So periodontal bacteria change the gut microbiome for the worse. Okay. They can also affect your skeletal muscle. Periodontal bacteria can cause insulin resistance and metabolic dysfunction in skeletal muscle. And this is because they can trigger inflammation and oxidative stress in muscle cells. So often, muscle pain that we're getting, particularly as it relates to fibromyalgia, could be related to these kind of issues.
Yeah. Oh, wow. That's so obviously, now, this is important information for everyone, to kind of get to, and why we're spending so much time on it, and why we're kind of putting it first. And we really want to get practical here, with our audience. The last thing we want to do is kind of overwhelm people with loads of information. So we're quite specific and deliberate. Said, what can we do? What can we do to help people now? Right now. So, sure, we can do some cool tests, and that's been amazing as well for me to learn all of these functional medicine assessments that are available, which look into these incredible amounts of detail. But if you had to understand, okay, we want to do a litmus test of our life, sort of stare at what's going on. What would we do? And I think we spoke about the tongue, and maybe you can jump into that and say, why can we use the tongue to almost be a crystal ball, into our oral health or gut health in general?
Absolutely. I mean, the tongue tells us so much. Okay. Your tongue is a reflection of your gut. So similar to like in reflexology, where your body is represented on your foot, or even like iridology, where it gets represented in your eye, your gut gets represented on your tongue. So it can give us a lot of information or information, sorry. The first step is to take a look at your tongue and see what is happening with your own oral biome, okay? The first thing that we're looking at, so if you stick your tongue out and you look at it, okay, the first thing that we're looking at is what is the color, okay? Is it nice and pink? Or is there a film on it, okay? Sometimes it can be white, sometimes it can be yellow. You can get all kinds of different, colors. And is it a thick coating? Is it a thin coating? What kind of coating is it? So that tells us that there is bacteria that is building up in your mouth, all right? And that's reflective of what is going on down below in your gut. So if there's a lot of stuff going on in your mouth, then you are going to have issues. And often it can be yeasts and candida. It can be other like non-favorable dysbiotic bacteria, or even sometimes a parasitic load in your mouth. Can be any of those that can start to cause problems. So this is an easy first step that anyone can do. There's no cost to it. There's no lab testing, and it gives us a lot of good information. A good way to think about these biofilms that are building up all the time is it's the plaque. It's basically if you feel, particularly after you've eaten anything sweet and you start to feel those biofilms on your teeth, it's the plaque that's starting to build up, and that's why we have to brush them. But that same biofilm forms on your tongue, and it forms in the rest of your mouth as well, and that goes down into your gut. and those biofilms can start to cause a lot of problems. So yes, so I think, Steve, are we going to challenge them to post a picture of their tongue?
But I think I also you were talking to me a while ago about, you know, fissures in the, you know, in the tongue, and also you know, what's happening on the side of the tongue, you know, in terms of that scalloping effect.
Absolutely. So that's the second thing we want to look at on the tongue. Okay, is are there fissures? You know, it can be deep fissures, like deep slices in your tongue, can be more superficial, can be like, you know, all kinds of areas in the middle of your tongue. It can be on the sides, and kind of horizontal or vertical. And that also tells us a whole lot of stuff. Can be in all kinds of different patterns. But it tells us, again, if there are fissures on your tongue, it tells us that your gut is not happy. In fact, I mean, it's probably then pretty unhealthy. So if you have a look on Dr. Google, you can Google some tongue fissures and get an idea of kind of what you're looking for. But obviously that's going to give you really extreme stuff. So what you're wanting to look for is more of the subtle things, all right? Just the beginning of those fissures where they're starting, but they're not like full blown like what you'll find on Google. So that's really what you want to look at, and you want to start to move those backwards. So start to get rid of those fissures, because they are signs that your gut is not healthy. So often, you know, what I find when there are fissures is that we need to look at stomach acid, and often the acidity of the stomach is not strong enough. And because of that, you're not breaking down food, you're not digesting and absorbing it properly. And so those fissures are a result of nutrient deficiency in your body. And yeah, that's what you're seeing on your tongue. The position of the fissures can also give you an idea of which area is a problem. Typically, the front of the tongue is more the stomach area. And as you go more backwards, that moves more into the small intestine, and even the large intestine. So have a look where those fissures are. That'll give you an idea of where more of the problem in your gut is. You'll find a lot of the time it's in the first half of your tongue. And that is then an indication of your stomach that is not healthy.
Gotcha.
And we'll move more into the stomach, obviously, on day 2 and elaborate a little bit more. So we'll start to connect all of those dots. But that's why, you know, have a look at your tongue today and see what's going on there in terms of color and in terms of fissures. And then the third thing that we want you to look at is scalloping on the sides of your tongue. So if you look right around the side, that's where you'll start to see this. And you need to look, are there ridges, or kind of like, is it looking a bit wavy, or is it nice and smooth? And again, that gives us a lot of information on what is going on in your gut. And often it's an indication of nutrition issues as well. Can be things like mineral deficiencies, often zinc, selenium, and that scalloping is showing that you are lacking in those minerals. Yeah, so keep it simple, really. Look for the color, look for fissures, look for scalloping. You can check that on a daily basis. You can see, is it getting better? Is it getting worse? Yeah, that scalloping is also often can be a swollen tongue. So your tongue can get swollen. And obviously then that starts to cause pressure as it rests against your teeth on the sides. And that can start to cause that imprinting of your teeth on the tongue. and that will cause the scalloping.
That's not always something to panic about.
Equally, your tongue can actually lose muscle mass, so you can end up with a tongue, on the opposite end. As opposed to being swollen, it can become kind of a bit thin, and losing, because it is a muscle, it can lose muscle mass and become sarcopenic. So yes, it becomes atrophied, and yeah.
Okay. So yes, we're going to challenge some people. So it's take a photo of your tongue, stick it out, and put it up in the group. Challenge. So we challenge everybody to do that. Take a picture of the tongue, stick it up in the group. We want to see it all, bad, ugly. Don't worry about doing all the oral hygiene.
Tell us
what now? Just
yeah.
Yeah.
Tell us what you can see on your tongue.
And the very last thing to do before we check out for today is let's talk about some simple, home-based action steps that we can take to start addressing that microbiome in the mouth, and we can see those changes happen really, really quickly.
Absolutely. So yes, obviously we want to give you some action steps now, what you can do to start to improve that microbiome. So the first thing is stop using regular toothpaste. All right. It really might not be improving the microbiome in your mouth at all. Please cut out any fluoridated toothpaste. Okay. So find toothpaste that does not contain fluoride. Fluoride is a neurotoxin. It's not good for us. So cut that out. What you can do is just use plain charcoal powder to brush your teeth. It's really cheap. It will last you a long time. And it binds up all of those bad bacteria in your mouth. So what we tend to do is oil pulling with coconut oil first thing. And you can do that for anything between 5 and 15 or 20 minutes. A tablespoon of coconut oil in your mouth. You swish it around. Basically, it's the same as using soap in your mouth, because a lot of soaps are made out of oil, coconut oil, olive oil, so on. So swish that around in your mouth. Spit it out. Just make sure you're not spitting it out down the drain, because it does get hard and it will give you it'll block your drain. So spit it out into the bin, and then after that, so that helps release and loosen all of the bacteria. And then after that, brush it with some charcoal powder. And the charcoal is a binder, so it will bind all of those microbes. And then it'll, when you spit out, you'll get rid of that. So that's a great starting place. Okay. The other thing to look at is to cut out your mouthwashes. Okay, all the traditional mouthwashes that you're using in the shops, they are designed to basically kill everything. If you think about, the layer of skin that often comes off in your mouth with those mouthwashes, they are really potent, and they kill the good bacteria as well as the bad bacteria. And we don't want to kill the good bacteria. We only want to get rid of the bad bacteria. So those are not a good idea. So what I would suggest is using a mouthwash made of a couple of different essential oils. They work really well. Just please make sure that you are using therapeutic grade essential oils, and not just any essential oils that you can just buy at the local pharmacies. They won't give you the same value. They won't give you that therapeutic benefit that the other oils will. And then swish that around in your mouth once you've finished brushing your teeth. And especially at night, last thing that you do before you go to bed, just swish with those essential oils for a minute or two, and then leave that in your mouth overnight. And that residue just sits there. It'll get rid of those bad bacteria, but it doesn't kill off the good bacteria. And that will start to improve the microbiome in your mouth.
Awesome. Well, let's wrap up again for day one. I suppose quick summary from my takeaways. Your gut starts in your mouth, so that's the first thing to understand. What happens in your mouth has a direct impact on your health, not just on your oral health, but your health in general. And we're starting to understand that more and more. The challenge is to take a picture of your tongue. There's a great litmus test to kind of understand where your oral health is at any particular moment in time. And then from an oral hygiene perspective, let's lose the toothpaste, lose the fluoride toothpaste, lose the mouthwashes, start bringing oil pulling into our daily routine, and then looking at essential oils to make mouthwashes with. We'll post a bunch of those after this today into the group to have a look at. So that gives you a bit of an introduction to the Gut Health Week. Tomorrow, the plan is to move down into the stomach. So we'll talk stomach health tomorrow, 8:15 in the group. And please, we'd love to hear from you. Let us know any questions, any information that you might not have got today and you want to find out. Please drop us a line, and we'll do our best to get back to you. But yes, thanks very much, everybody. That's day one dusted, and we'll see you tomorrow morning, 8:15.
Thanks, Steve.
Thanks,
all right,
everyone.
have a great day.
Bye.
Bye.